Hello, once again. My name is Eni Mushoshi and I'm a Nightingale student. Today, I'm here to demonstrate how to administer IV fluids and medication. We're going to perform the 6 patient rights of medication administration, making sure we have the right patient, the right medication, the right dosage, the right route, the right time, and the right documentation. Once that is done, we're going to perform 3 medication checks. First, we're going to check and make sure that we have the right medication and that medication has not expired. Second of all, we're going to make sure that we have the right order, the right medication, and we're comparing this with the electronic health record for our patient, making sure that everything matches the medication and what we have on paper. The last check, we're going to perform this with the patient. We're going to use 2 patient identifiers and we're going to ask our patient if they have any allergies. Once that is done, we're going to look at our order. And in this case, the doctor has ordered us to give 150 mLs of IV fluids over 60 minutes. So we're going to multiply 150 over 60 multiplied by our drop factor of 15 GTT over a milliliter, and that will give us 37.5, which we rounded off to 38 GTTs a minute. For our medication administration, we're going to be giving amoxicillin 250 milligrams at 100 mLs over 15 minutes. So we're going to calculate using our drop factor, which is 15 drops over 1 ml times 100 mLs over 15 minutes, and that's going to give us 100 GTTs a minute. I'm going to have 2 primary tubings with me here. I have 1 primary and I have 1 secondary tubing. So I have 2 tubings with me. I'll start with the primary tubing. The primary tubing is what I'm going to use for my IV fluid. The primary tubing has a spike end, as you can see, that is kept, and this spike end has to remain sterile until I'm ready to administer my fluids. And then I have a drip chamber right here, which is what I'm going to use for my drop factor. And I also have a roller clamp right here, which can open and close, and I'm going to use that to prime my tubing. I'm also going to have a Y port right here on my primary tubing, which is what I'm going to use to connect my secondary tubing, which has my medication, to this primary tubing. And I also have, lastly, the adapter end, which is what goes into the patient IV site. I have my secondary tubing with me right here, which is what I'm going to use for my medication, in this case for my amoxicillin. It has a spike end, it has a drip chamber, it has a roller clamp, and it has an adapter end, which is what I'm going to connect to that Y port that I showed you on my primary tubing. In this bag as well, I also have this hook that I'm going to use to lower my bag of IV fluids just below the piggy bank, which is the medication IV bag. I also have the medication and the IV fluids. This is the IV fluid bag. I also have my medication, my amoxicillin, well labeled. As you can see, patient name, date, time, flow rate, everything is labeled on my medication bag. Now I'm ready to start my IV. I'm going to perform hand hygiene. I'm going to wear my gloves. And I'm going to get my IV fluid bag right here and my primary tubing. I'm going to open my IV fluid bag and I'm going to open my spike end and right away spike my IV fluid bag I want to make sure that my roller clamp is closed because you don't want those fluids to flow out, all of them, without you being able to control. So I'm going to make sure that this is closed, and I'm going to hang my IV bag like so. I'm going to let at least half of the fluids into this drip chamber. As you can see. And then I'm going to remember my drop factor, which is 38 drops per minute. But first of all, before I do that, I'm going to prime my tubing. I'm going to open my tubing and let fluids out, maybe a few drops run out, just to clear if there's any air bubbles in my bag. So I'm going to prime that tubing and I'm going to open the clamp. Now I have a few drops coming out and I'm going to close my clamp. I'm going to use my drop factor and count for a whole minute. I want 38 drops a minute. So I'm going to go ahead and start counting as I let the drops flow through opening my clamp. Okay, once this is done, I'm going to close my clamp right now and I'm going to put this aside. Making sure to keep that cap on. We don't want this touching any surfaces. Keep it on, put it back on, and take my secondary tubing here. And I will take my medication IV bag right here. I'm going to open the bag. I'm going to open the spike end right here. And then I'm going to spike my IV medication like so. I also want to make sure that that clamp is closed all the way so we don't have our medication flowing out of the tubing. And I will use the hook that I have the loop to lower this bag, the IV fluid bag. I'm going to use that to lower it below my medication, like so. And then I'm going to put this up here. Okay, so I'm going to do the same thing as I did last time. I'm going to fill my drip chamber halfway through, or at least 2/3. Like so. And then I'm going to open my clamp right here and just let out a drop and close my clamp. I'm going to take my alcohol wipe right here and my primary tubing and go to the Y side or the Y ports and clean these Y ports and let it dry. Once it has dried, I'm going to connect this the piggy bank, the secondary tubing, to my primary tubing, like so. And then I'm gonna go back to my IV fluid bag, and I wanna make sure that the container of this IV fluid bag is at least 30 inches above the IV site of my patient if they're an adult. So I'm gonna go up here again, and I'm going to open my clamp, and I'm going to count 38 drops for a minute. And there we go. I have my 38 drops per minute counted. I'm going to go to my piggy bank, and remember I have 100 for my medication. I calculated 100 drops a minute. So I'm going to start working with my clamp here, and I'm going to count for a full minute, 100 drops, titrating with my roller clamp. And there we go. I now have counted 100 drops for a whole minute, and my IV is ready. I'm going to make sure that I gather all the supplies and discard. I'm going to remove my gloves, and I'm going to perform hand hygiene, and always remember to document what I have done. If we don't document, it has not happened. So I'm going to make sure that my patient is comfortable and everything is running good, and I'm going to do my documentation. Thank you, and see you next time.